way to the birth center. I'm 7 centimeters, 7 centimeters. And 80% face. Baby could be here in the morning.
So you've heard of a hospital birth and you've heard of a home birth, but have you met a birth center birth? Hi, my name is Kayla Natalie. I'm a certified birth doula, and I find that we talk about hospital births and home births, but we rarely talk about birth centers. So let's talk about them today. Birth centers are the best of birth worlds. Birth centers bring that sense of security that a hospital birth has, while also being in the feels of a home birth. A lot of people choose to have a hospital birth because they are closer to things that they want. They want the IV, they maybe want some pain medication, they want the nitrous oxide. Most of the times are not available in a home birth setting. And a lot of people like the sense that if something goes wrong, that they are right there. On the other hand, people choose a home birth because they want more one-on-one connection with their provider. They want the patient-centered care, which unfortunately a lot of times the hospital does not have. They want dimmed lights and not to be touched as much and to have bodily autonomy over their birth. A lot of people who choose a home birth want an undisturbed birth. And when you want both of these things, the perfect middleman is a birth center. A lot of times they are set up like a hospital, but then they also have little touches of a home birth as well. As you saw in this video, there were low lights, not very much stimulation, because physiologically, when we are in that birth space, we are in that birth cocoon. We need the low stimulation, we need the low lights in order to do what our body is naturally supposed to do. And when we disturb that by having bright lights and by being touched a lot and having a lot of stimulation, that can disturb birth. Kind of brings the mom out of that trance-like state, and you may see more stalled births that way. And we actually have really good data to support the use of birth centers, especially for low-risk patients. There's a lot of birth workers on these apps who will say, no, absolutely no home births, or no, absolutely no hospital births. But here's the thing, there's absolutely a great middleman and not very many people utilize it. And I am someone that supports anyone in whatever decisions that they decide to make for their own birth. Whether you choose a home birth, hospital birth, birth center birth, that is great. And I just wish more people thought like that.